Okay, let's continue with bones of the upper extremity. And now we're down into the forearm. So you've got two bones in your forearm, and you've got a lateral bone and a medial bone. This is the ulna, and it's got kind of this U-shaped bony area on its proximal end, so that's how you can tell it's the ulna. Ulna is always going to be the medial bone in the forearm. It's on the pinky side. And then this is the radius. So this is the other bone of the forearm. This is always going to be on the lateral side of the forearm or the thumb side. Okay, so that's how you should be able to tell them apart. Some bony landmarks on the ulna. If we start at the proximal end, so this is going to be the end that articulates with the distal end of the humerus. We can see a couple things. This bony projection proximally is going to be the olecranon process. And this is the bony projection that you can feel in your own elbow, the bone that's sticking out. This indented area here is called the trochlear notch. So it's indented because it fits really nicely with the trochlea of the humerus. Okay, so trochlea of humerus is going to articulate with the trochlear notch of the ulna. Okay. This bony projection here is going to be the coronoid process. Okay, little bony part sticking up, and again, coronoid process is going to fit really nicely into that coronoid fossa of the humerus as you flex your elbow. If we look on the lateral aspect of the ulna, we can see this little smooth indented area, and this is the radial notch. So this is where the radial head is going to fit in really nicely to the ulna. And basically the head is wrapped with an annular ligament, and it's going to form a pivot joint so that you can rotate your forearm. But that's the site of articulation between the radius and the ulna. Okay? And then if we look at the distal end of the ulna, we see this bony projection here. This is the ulnar styloid process. So this is a bony prominence that you can actually feel in yourself at the distal end of your forearm. So again, knowing left from right, for this ulna, we know that the ulna is always going to go medial. So this bony projection needs to be on the medial side of the bone, and this radial notch needs to point laterally so that it can articulate with the lateral bone, which is the radius. So this particular ulna would be a right ulna. Okay. And then if we look at radius, we've got a couple landmarks here. We've got the round radial head at the proximal end. And then this bony projection here is the radial tuberosity. Okay, and that serves as an attachment site for the biceps muscle. Okay, so again, radial head is going to fit really nicely into that radial notch of the ulna. And it's actually going to go like that. And at the distal end of the radius, you see this bony projection here. This is the radial styloid process. So both forearm bones have a styloid process at the end. The radius one is going to be more lateral, and the ulnar styloid process is going to be more medial. And also too, if we look at the distal end of the radius, you can see this smooth indented part here. This is the ulnar notch of the radius. So that's where the distal end of the ulna is going to articulate with the distal radius.